Dry, scratchy, irritated eyes? The problem may be your eyelids. In this episode of OCuTALK, optometrist Alan Austin tells us all about anterior blepharitis, the differences between anterior and posterior blepharitis, the different types of anterior blepharitis, the symptoms you should look for, as well as the treatment options, and the real importance of eyelid hygiene. Hello and welcome to OCuTALK. Today we're going to be having a conversation with optometrist Alan Austin. Hello, doctor.
Hi, how are you? Thanks for having me today.
Well, we're so excited that you could join us. Could you tell our audience a little bit about your background and your specialty?
Of course. I'm an optometrist with a focus in ocular surface disease. I'm an adjunct clinical professor at the Southern California College of Optometry, and I lead a dry eye specialty, dry eye practice in Orange County, California.
Okay, so for our conversation today, we were hoping you could talk to us about the different types of anterior blepharitis. So to get started, what is anterior blepharitis?
Sure. So anterior blepharitis, anterior means the front. So we're talking about the front portion of the lid. So we'd be dealing with the lid margins, the lashes. Posterior blepharitis, posterior meaning the rear, would be the rear portion of the lids, which would be the meibomian glands. And these are glands that can get plugged up and they can get infected as well.
So what are some common symptoms for anterior blepharitis?
So patients who present with anterior blepharitis, they're usually complaining of having crusting on their lashes in the morning. They may also present with red eyes and the lid margins might be inflamed as well.
What are some common complications that come about because a patient has anterior blepharitis?
Yeah, blepharitis can have a real effect on patients' ocular health. These are the patients who will usually have recurrent styes or hordeolum or chalazion. They keep getting styes. They don't know why they're getting them. The debris from the blepharitis, the crusting on the lashes, can actually fall into the glands and plug them up. So blepharitis is often associated with, again, recurrent styes and also dry eye in general. It can cause issues as far as inflammation.
So can you tell us a little bit about staphylococcal blepharitis?
Sure. Staph blepharitis, obviously caused by staph bacteria, one of the more common presentations we see in patients who have blepharitis. These are the patients who are going to have more of the hard crusting on the base of the lashes. They may have more red, irritated eyes, and they will have sometimes some foreign body sensation as well.
How can you determine if it's staph bleph versus a different version of anterior blepharitis?
Great question. The other thing that you see sometimes in patients who have staph is lash irregularities. They may have irregular lashes that are growing into the eye or growing away from the eye. They may have lash loss. They may be sparser than they would normally be. So I tell these patients that if you can get this under control, I use the analogy of if the soil isn't good, the crops aren't going to grow well. So if you can clean up that lid margin there, when the hair growth cycle or the lash growth cycle resumes, usually what comes back in when the lashes regrow, they're going to be a lot more regular, fuller, more lush. So patients always appreciate that.
I'm sure they do. Can this type of blepharitis lead to other ocular complications?
It can. We've discussed how it can contribute to styes, recurrent styes, which can then progress to chalasia, where the glands get infected. If they don't drain properly, then they become a chalazion, which are just more stubborn to treat. It can cause issues with the eyes being dry and then also chronic inflammation of the ocular surface as well.
Okay, so now can you tell us about seborrheic blepharitis? What's the difference?
Sure. So Seberic Blepharitis is often associated with seborrheic dermatitis, especially if it's located on the face or the scalp. And this is when you get those more kind of yellowish, waxy flakes on the base of the lashes.
So what is the telltale sign that it's seborrheic blepharitis versus one of the other forms of anterior blepharitis?
Yeah, usually they'll have less inflammation with seborrheic blepharitis. And when you look at the lashes, them will be kind of more matted and kind of oily or waxy there from the crust on there.
Okay, so now what about Demodex related blepharitis? Can you tell us what
Sure.
that is?
Sure. So Demodex blepharitis is actually caused by mites that live on the skin surface, and patients don't like it when you tell them they have mites on their skin. But I always let them know that everyone has these mites. Some people just have more than others. It has nothing to do with poor personal hygiene or not taking care of themselves. But if we let them know that it can be treated, and it's something that is actually more common than you may think.
So, if everybody has these mites living on their eyelids and eyelashes, how can you tell if it's mites that's causing the blepharitis?
So, a couple ways you can tell. The easiest way to tell is just have the patient look down when they're at the microscope or the slit lamp there. If you see any collarettes, which are the pathognomonic sign of Demodex blepharitis, collarettes are crust at the base of the lashes. They're sort of the byproducts of the mites, the eggs, and waste products. Um, if you see even one collarette, then you can be sure that it is actually Demodex blepharitis. And the presentation can vary. You can have as few as one or two collarettes per lash, all the way up to sometimes 2/3 of the lash can be filled with collarettes there. You can epilate a lash and put it under a microscope. And sometimes you can just see the little critters kind of crawling on the lid margins there. So a couple ways to tell, but the easiest way is if they have a collarette, then they have Demodex blepharitis.
Okay, so I guess we've talked about a lot of different kinds of anterior blepharitis. What does the diagnostic process look like so you can determine exactly which type it is?
Um, some of it depends on patient symptoms, but when you look at the actual lids and lashes there, that's really the best way to determine what's going on. So with staph blepharitis, you're going to have more inflammation. You're going to have possibly a little more redness in terms of the conjunctiva. And you'll have more of those hard crusts on the base of the lashes. Seborrheic is going to be a little less inflammation. You may have some redness on the lid margins, but you'll have more of those kind of waxy or oily type of yellowish flakes on the base of the lashes. And then, of course, with Demodex, you're going to have sometimes itching, redness in the eyes as well as some of the patient's complaints. But you want to look for those collarettes. The collarettes are really the way to differentiate for Demodex.
So, what treatment options are available for anterior blepharitis conditions?
Quite a few. The most important thing you can do if you have anterior blepharitis is really keep the lid margins as clean as possible. So I always recommend for my patients when we diagnose them to do some sort of lid cleaning, be it lid scrubs or lid foam. Hypochlorous acid is fantastic. It's one of the things I find to be one of the most effective ways to manage blepharitis. You can spray it onto the lashes, or what I tell patients is you can spray it onto a flat cotton makeup remover round, kind of the stackable ones, and dab it onto the base of the lashes. That way you can direct the product right where it wants to be. There are tea tree treatments as well for Demodex blepharitis. Those can be effective. And there's in-office treatments. Treatments like BlephX or Zest. IPL is very effective as far as reducing the bacterial load to the eye. And for Demodex blepharitis, there is a prescription medication called Xdemvy, which is very effective in terms of treating Demodex blepharitis as well.
How important is cleaning makeup off the eyelids and lid margins for blepharitis conditions?
Crucial. I mean, you need to keep that ocular surface, those lid margins, clean as possible there. So, one of the most common complaints I get in my practice is from women who say they can't wear eye makeup, they can't wear eyeliner, they can't wear mascara. Interferes with their self-confidence, their ability to present themselves professionally. So the more you can keep those lid margins clean, the better chance they're going to have less complications and be able to wear eye makeup successfully.
Do you have a long-term protocol that you recommend for patients to continue with this ongoing care?
Yeah, I mean it's chronic. So I tell patients we're not going to cure blepharitis, but we can definitely improve your symptoms, improve the quality of your life, and keep things from getting worse as time goes on. So we definitely want them to be on some sort of regimen where they're cleaning the lids and lashes, ideally twice a day. That's the most effective way to keep things from getting worse and having complications as time goes on.
Wonderful. Well, doctor, is there anything else you want to tell our audience today?
Just that Blepharitis is really common. It's probably one of the more underdiagnosed, undertreated conditions that I come across as an optometrist. But I always like to stress that there's many things we can do to help with the condition. It is easy to treat. And if you do a good job as far following the protocol that your eye doctor gives you, you'll have a much better chance of having less issues down the road.
Wonderful. Thank you so much, doctor.
Thank you. I appreciate being here.